Okay, before we start the webinar, I'd like to share a little bit about about SIAC. To introduce about Strategic ASEAN International Advocacy and Consultancy, or you can call it SIAC. SIAC is a strategic business, government, public affairs, public policy, corporate legal consultancy and research firm, established in 2010. So the firm started as a strategic partner to ASEAN Secretariat in managing the implementation of ASEAN Economic Community Roadmap. So the company today has evolved to successfully providing strategic counsel to CEO of the MNCs, government and public policy affairs, marketing and business development team, as well as project management. So SIAC also worked on several embassy-related projects, and in 2021, SIAC has been appointed as co-host of T20 on global health security and COVID-19. Okay. So the event today focused on the momentum of G20 and Indonesia's healthcare future forward. So the T20 is the G20 official engagement group, who is responsible for connecting and collaborating with regional and international think tanks. So we have had several meetings with our counterparts in Japan, Australia, and India, since India will be chairing G20 in 2023 on healthcare agenda, and the participation of healthcare companies at the T20 of G20 on global health security and COVID-19. So the T20 is focused on 10 policy areas and submission of concept paper to the leaders of the G20 to be embedded in the leaders' declaration. So Bapak Ibu, today we will have a prominent speakers. We're still waiting for some of them. So I would like to remind you again to, if you need the presentation of speaker, we will share with you, but please help to fill the Google Forms provided in the chat box. So, okay, I think Bapak Sekjen, Pak Kunta already here.
Yeah, Pak Kunta is here, right? I saw.
Yes, yeah. All right, I think.
Sorry, but I still in another Zoom. If it's okay, maybe Pak Asbullah dulu atau Bu Baby dulu ya. After that, I join.
Thank you, Pak. That's fine, Pak. Be flexible.
Yeah, just 10 minutes. I need 10 minutes to finish this another Zoom. Sorry, Pak Prof. Hasbullah.
Yeah, thank you. No problem.
Okay. So I think before we start, while we are waiting for Pak Sekjen to join us, I would like to introduce our moderator today, Ms. Shanti Samdashani. Yeah, she's the CEO of SIAC and the co-chair of T20 on global health security and COVID-19. So Ms. Shanti Samdashani has provided consultation and formed advisory panels that lead US, EU, China, Korean business engagement with senior government officials on market entry and addressing entry barriers. So she was an active member at the NASDEM political party, carrying the economic section and driving various policy agenda, working closely with the parliament and the government bodies. So she has spent 17 years working for large US and European MNCs as a senior regional director position, working in 4 different countries. And she is graduated from Harvard University on digital transformation and catered to Fortune 500 ICT companies. So without further ado, Ibu Shanti, I would like to call you.
Thank you for that, Ria. Good morning, everyone. Really a very good turnout. We have 300 over participants. I would like to thank our chair this morning, Prof. Hasbullah Tabrani, His Excellency Minister of Health of Indonesia, Budi Gunadi Sadikin, Pak Sekjen, Pak Kunta. This morning, Dr. Maxi couldn't make it, so we have replacement Ibu Beki. Let me just start by giving a brief background and then introduce our speakers today, and then get the discussion rolling. So the event today focuses on momentum of G20 and Indonesia's healthcare future forward. The T20 is the G20's official engagement group, which is responsible for connecting and collaborating with regional and international think tanks. We have had several meetings with our counterparts in Japan, Australia, and India on healthcare agenda and the participation of healthcare companies at the T20. The T20 is focused on 10 policy areas and submissions of concept papers to the leaders of the G20 to be embedded in the leaders' declaration. Today, we will hear from the chairs of Healthcare Working 1 and 2 on G20 leadership on driving Indonesia's healthcare future forward, as well as the focus areas of the healthcare working groups. The healthcare industry, local and foreign companies are excited that Indonesia is hosting G20 this year, and that the healthcare is part of a big agenda within G20. Indonesia is rich with regards to the raw materials and resources that can cater to sustainable healthcare moving forward, and we will hear that elaborations today as well. I'd like to introduce our speakers this morning, and at the end of the session, we will have a question and answer session, and we will indulge in a discussion which will highlight more on the G20 participation of this year. The speakers for this morning, we have a keynote speech from His Excellency Minister Budi Sadikin. We have Pak Punta Wibawa Jasa Nugraha, who is the Secretary General, Ministry of Health of Indonesia. He is also the chair of Health Working Group 2 on building global health system resilience. We have Dr. Maksi Rendonowu, Director General, Disease Control and Management, and Chair of Health Working Group 1 on harmonizing global healthcare protocols and standards. In this case, Dr. Maksi is represented by Dr. Prastuti Suwondo, who is the expert staff to the Minister of Health. We have the next speaker, Dr. Raymond Chandrawinata. He's the Director of Research and Business Development at DEXA Group. Professor Hasbullah, who is the chair of T20 of Global Health Security and COVID-19. And lastly, myself, Shanti Shandasani, who's co-chairing, the co-chair of the T20 of Global Health Security and COVID-19. I'd like to start this session by welcoming His Excellency Minister Budi Sadikin for a brief keynote speech. Minister Budi.
Distinguished speakers, ladies and gentlemen, resilience is a word we have heard to a great extent during the COVID-19 pandemic. It brings to mind powerful image of strength, speed in response, and ultimately survival against the odds. It suggests a certain agility as well as an ability to bounce back together stronger than ever. Collective resilience is essential for humanity to thrive through any crisis, including this health crisis. Only through collective resilience will we rise from the ashes and build a stronger global health architecture that will protect this generation and many generations to come. Ladies and gentlemen, as Indonesia assumed the G20 presidency, President Jokowi proposed reform in 3 areas: global health architecture strengthening, sustainable energy transitions, and digital technology transformations. In the health sector, Indonesia is committed to 3 priorities. First, we encourage countries to build a global health system resilience by synergizing financial and essential medical countermeasures mobilizations and enhancing global health surveillance system. Together, we must enhance our capacities to prevent, detect, and effectively respond to pandemics, in a highly coordinated manner. This can be done, among others, by optimizing the open and trusted genomic data sharing platforms. Second, harmonizing global health protocol standards. To revive global mobility of people and goods, it is essential to ensure a comprehensive health protocol standard safeguarding the world from future disease outbreaks. We must realize that the problems of modern times require innovative solutions. Together, we need to harmonize global health protocol standards in international travel to allow for rapid social and economic recovery, among others, by enabling digital applications to mutually recognize health information systems for cross-border mobility. Third, expanding global research and manufacturing hubs for pandemic prevention, preparedness, and response. The world demands new ways of thinking about the health system, and we should not put our eggs only in one basket. We need to expand the global research and manufacturing capacities of health products, particularly for vaccines, therapeutics, diagnostic, and personal protective equipment. Together, we need to streamline the essential countermeasure supply chain to reinforce health system globally. Ladies and gentlemen, local healthcare industries is the backbone of healthcare delivery that provides the strong support system the country needs. Just as how a community should be, a supply chain needs resilient members. Vendors, suppliers, and service providers who bring operational resilience at scale. As the world is still grappling with issues around medical countermeasures, equitable access to fight COVID-19 remain vital. With the support from local industries, Indonesia's G20 presidency will spearhead collective efforts to ensure equitable and universal access to vaccine, therapeutics, and diagnostic to be more adequate, sufficient, and readily available. Ladies and gentlemen, resilient health systems are the bedrock of emergency preparedness and response, and ensure that when acute events occur, essential health services can be maintained. It is our responsibility to ensure that we learn the lesson the COVID-19 pandemic taught us, to build a stronger health system with adequate access to medical countermeasures. This cannot and must not wait. We must protect the generations of our children and the generations of their children. Before us, we have a once-in-a-century opportunity to strengthen and transform our health system. Let us accelerate our efforts to recover together and recover stronger. The future belongs to the bold. Thank you very much.
Thank you for that, His Excellency Minister Budi Gunadi Sadikin. We move forward to our next event, and I know Pak Sekjen Kunta is very tight this morning. He's got a 10 o'clock meeting again. So without further ado, I'd like to invite Sekjen Pak Kunta Vibawada Sanugraha to give us his narrations. Pak Sekjen, please.
Okay, thank you. Thank you. Okay. And everybody in here, sorry, we have Pak Asbullah and Pak Peter and everybody that I cannot mention everyone. So the invitation for me is we will discuss about what is the second head working group agenda for G20. Actually, like Bapak, our minister, Pak Budi Gunadi, want to propose the whole agenda, about the strengthening of global health architecture. Based on that, actually we have a 3 priority issues. My slide can ini. Okay, so we have 3 priority issues. If you can move to the slide number 3. The issue is one is the building global health system resilient. Next slide, please. In the building global health system resilience, actually we have 3 program in there. First is about the financial gap. Actually, financial resource mobilization for pandemic prevention, preparedness, and response. And this is about the financial gap that we already know that when we have a pandemic, even though we have money, but yeah, somebody didn't have money, or not somebody. The countries, especially in the low middle income countries, didn't have money and didn't have access to the countermeasures. But like Indonesia, we have money, but we cannot have access to the countermeasures. So based on this experience, we want to propose the 3 programs in here. One is financial stabilization. Second is essential health resource mobilization for pandemic prevention. It's about the countermeasures. And the third is about the optimization of genomics and strengthening trusted data sharing mechanism. This is very important. We want to improve the way we are discuss about the data sharing mechanism, especially in the situation of pandemic. So the initiative, this is the program. The initiative is continuing the establishments of a new financing PPR mechanism. Like you know that the previous Italian G20 presidency is carry out this issue to us, and then we established we call it FHTF, it is Financial and Health Task Force, that discuss every month about this. What is the mechanism and what is how to filling the gap about the financing gap. And then for the countermeasures, we want to establish the initiative establishing a global mechanism for raising, assessing, and mobilizing essential health resources, especially when we have the condition in the health crisis. And the second initiative is optimizing the global genomic data sharing platform and the trusted by scientists around the world. Like now we are have the KISET and the other platform, the other KISET and WHO hub. So based on that, we are going to optimizing this existing system, so we can have a data sharing for everybody or for every country in the world. This is our priority issue 1, and the priority issue 2 is about the harmonizing global health protocol standards. This is about we want to harmonize the system to recognize the COVID-19 digital certificate. So this is not one platform, but the one QR code. So we can access, or we can read each other using the same QR code. The inside of the QR code is in line with the standard of WHO for international travel, like what the fact how many vaccine we already got, we positive or not, something like that. This is already standardized by the WHO, and then based on that, we have the same QR code, so everybody in the world can have the same QR code, so we can read each other based on our application. Like Indonesia, we have Lindungi, and Saudi Arabia we have a Tawakal, and every other country have a every country have a different application, but we have the same QR code, something like a passport. We have many passport, but we have the same QR code and the same standard. So when we enter to other country, we didn't need to have their application, but we can use our application, our own application, but we can read each other. And then we put the mutual recognition, and the initiative is harmonizing, like I mentioned. And then the second is mutually recognized COVID-19 vaccine certificate. The certificate of vaccine. And then the third priority, and this is Bu Peggy will explain further about that. This is about we want to expand. Bu Peggy is harmonizing. Sorry, Bu Peggy and the priority 2. Priority 3 is about the expanding global manufacturing and research hub for pandemic for PPR. This is a 2 program here. This is expansion the global manufacturing hub for vaccine, or VTD, vaccine, therapeutic and diagnostic. And the second is sharing knowledge for prevention, preparedness, and response and health crisis. So we want to expand the global VTD manufacturing hub, especially Indonesia, to become the hub. Right now, our position is a spoke, I think, a spoke from WHO, and the hub is in South Africa. But we hope that we can have many hubs in the world, so we can share together and we can expand our research and the production of the vaccine. And then the second is initiative is strengthening global network of scientists. This is about the information, data sharing, the research result on in the lab and everything. Then we can share this information and data in the sharing. So the network of the researcher is very important in here, especially the scientists, on virology, immunology, epidemiology, behavioral science, to public health emergencies. Because with our experience, like now, the diseases is about the virus diseases. So it means that next, we hope, but it's not happen yet. Next, maybe in the future, this will be happen again, or I don't know yet, but that we already have some network on the scientists and network on the lab, so we can prepare better than before. This is our priority issues, the program and initiative, and this new. I think this is just the schedule is from January and the November. What we are prepared for 3 things that we are already discussed. First, WHG head working group number 1. First head working group is in the end of March in Yogyakarta, but the first head working group is on the priority number 2 about the harmonizing global health protocol standard, because we are already we have ready for that there, because we already discussed with many countries, with AU, with Asian countries, and then APEC, and that is what is the important thing of we have the health protocol standard. And so the first head working group is on this second priority and the global standard, and we have the side event in TB in back-to-back with a head working group. And in June we have a head working group, second head working group. This is on priority number 1. It's about the global health system resilience. We discuss clearly about financing gap and the countermeasures of the medical tools. And we have the side event back to back with the second head working group about the one head. The third head working group is on August. This is the third priority about the expanding group manufacturing and research hub, and the back to back with the side event on AMR. AMR is MMR. EMR is antiseptic microbial resistant. Okay, this is the general timeline, but maybe I move to next slide. Yeah, and this is our expected outcome and deliverables. We want to, right now, we already send this concept note to every, not every country, to the G20 members. Before in December, we have the issue note, and this month we send the concept note in more detail about our deliverables and all outcome to the G20 members, and we hope we can have feedback from them, and based on that we can know what is the input and all the feedback from the other countries, and then we can discuss about that. So the expected outcome, like I mentioned before, first is about we want to identification of short, medium, and long-term global health enhancing gaps, and this is discussed detail with in the FHTF, Financial and Health Task Force, with Indonesia and Italy become the chair, and we want to build the domestic and regional and global coverage of system to prevent, prepare, and respond to the pandemic. But in this situation, we want the two situation, yeah, in the peace situation and the pandemic situation. This because it's become a different mechanism, not mechanism, different what we want to respond, different response based on in the peace situation and the pandemic situation. And then the other deliverables or objective outcome is identification of option for mobilizing essential medical countermeasures. This is a countermeasure, the resources to the countermeasures, not only in the financing, but also the access to the health resources, medical or countermeasures or resources. So, like you know that in this, like I mentioned before, that we have already we want to not only money but also the access to the health resources, and we engage a lot with the ACTA mechanism and learn from this initiative, and maybe we can expand this ACTA and discuss more about that. And the last is about the agreement among G20 members countries to continue to utilize the GSET as a universal data sharing platform. But this is still discussion about that, and we open the input and feedback from other countries about that. But we know that right now the GSET is the one that is independent body that already have a data sharing platform, and we can expand the platform beyond maybe not only COVID but also the influenza, SARS-CoV-2 and RSV. Based on this all, the proposed outcome document is about the mechanism for resource allocation and financing, medical countermeasures, and data pandemic prevention, preparedness, and response. This is what we want to do in next head working group, the second head working group. And next step is our roadmap. Is from January, February until November, of course. So we now already in maybe in the last slide. Yeah, like now we already in the March, like I mentioned, we already sent in the January, we already drafting the concept note and discuss a bit. So sorry, maybe I repeated it. In the head working group number 1 and number 2, it is priority number 1. We divide by 2 because in the same time we have a FHTF. So not only they are back to back, there's something like that. Yeah, inline. We need to inline with head working group now. Second head working group with FHTF, financial and head task force. So in the head working group, second head working group, we already sent the concept note and we already drafting the concept note and discuss with international organization in February and March. We want to send the concept note this month, and we want to circulate the survey about the traditional data sharing platform, and the feedback from G20. We waiting the feedback on G20, and April we have a consultation and the first head working group and drafting the circulation of proposed agreement and that recognize the GSA. At the same time, we have a FHTF. The second row is about more about the second year financing gap and the countermeasures. From January, every month we have a meeting with them, with finance and head deputies in G20, chaired by Indonesia and Italy. Discussion of financing in January and February about the update the co-chair and monitoring the vaccination test with ACTA. And this March, and maybe in 21st of March, we have the third FATF. We want to follow up the first FMCBG meeting. FMCBG meeting is financial and central financial minister and central bank meeting. And then we discussed the G20 paper concerning the gap assessment. So we will continue. Actually, just to slide again, it's about the step we want to do until the November, and then the outcome and deliverables, like I mentioned before, is about the three things: the financial gap, the countermeasures with the existing mechanism. It is ACTA and everything, and then we want to optimizing the genomic data sharing. Is improving or not improving. It's about expand the platform, like Kiset mentioned. I think the last thing is about opportunity for external contribution from the second head working group. I just read this. Minister of Health have sent out the concept note, like I mentioned before, for all the priority issues to G20 members and international organization on Monday, 7 March. And then we want to hear their feedback. And then the concept note were consulted the external expert throughout January and February. Like we know that we have consulted the international and national experts such as WHO, UNICEF, Gavi, the Global Fund, Prospera, GSAID, and ATG. And on the other hand, the Financial Hack Task Force, like I mentioned, already set out a couple of external institutions that will contribute to the expected deliverables. The opportunity to contribute directly to the expected outcome and deliverables. And then second is contributing institutions have been identified, maybe like WHO, World Bank, and ACTA. However, there are opportunities to contribute indirectly to the second head working group, such as helping the dissemination of the second head working group and FATF outcomes, and treating policy recommendation following up the second head working group and FATF outcomes. This is the opportunity for external contribution to the second head working group, and then we can discuss today too, to have your comment and your feedback from us, input to us. Thank you. I offer to you, the moderator.
Thank you for that, Pak Kunta. We are very sorry that I think we have been hacked recently, and we are trying to solve the issues. But we have one question in the chat box, and I think the question is from Pak Andreas. And in the interest of not being hacked, maybe I would like to read the question. The question is about data sharing genomic and how we can make sure not against the privacy law like GDPR. Pak Kunta have to leave by 10 o'clock, so I'm trying to take just maximum 2 questions here. And maybe Pak Kunta, if you could answer the question from Pak Andreas in terms of the data privacy law, in terms of the data sharing part. I think you're muted, Pak Arya. Can you unmute him?
Okay. So sorry. Could you repeat it, this question?
What about the data privacy sharing part? Because you mentioned about sharing data, right? And there is this regulation on data privacy.
Oh, yeah. So,
yeah.
I agree about that. Yeah. So actually, this mechanism is already in there. Yeah, you can see there about the GSET mechanism. We are sharing the data information, and WHO hub is sharing about the specimen, about the material. So we just want this information, not the privacy is already in there. Yeah, so we didn't touch the privacy and everything, but we can set the data and information is out there, and we can something like discuss and have analyze based on this data information, and we can something like have a network, something like that. So about the privacy, we continue the existing mechanism. If you can answer this question.
Okay, so basically following the current regulations that applies in Indonesia, is that correct?
Not only in Indonesia, but just globally, yeah, because right now we have the mechanism itself, like GSET, like WHO hub, and this data sharing on the lab networking. Like right now we have a hubs, and so this is already a mechanism, existing mechanism, and then the regulation itself about the privacy.
Okay, thank you. Is there any other question for Pak Kunta? One more question before he leaves. Okay, if there are no more questions, then thank you so much, Pak Sekjen, for your time. I know this is your very busy morning today.
Sorry.
So again, we would like to apologize for the hack. We will look into that issue, but thank you again, Pak Sekjen. And we'll now move on to our second speaker. Our second speaker is Ibu Becky. She's the expert staff to the Minister of Health. She is currently representing Dr. Maxi Rondonuwu. And I'll now please ask Ibu Becky to give her narratives. If you can unmute Ibu Becky, please.
Well, I'm trying to find Ibu Becky. Wait.
Yeah, there she is.
Okay. Ibu Becky?
Can you hear me?
Yes.
Yes, Ibu, we can.
Okay. Thank you so much. Good morning, good evening, everybody. Thank you on behalf for Pak Maxi. Thank you for the invitation. And I will share the progress of the Health Working Group 1. Actually, Pak Sekjen already start to explain a bit, and I will explain more. Would you kindly share the PowerPoint, please? Because I already sent it to Pak Hasbullah. Okay, thank you. Okay, slideshow, please. Yeah. So in the Health Working Groups 1, actually the title is Harmonizing the Global Health Protocols. So we picked these initiatives for harmonizing the global health protocols. I think it's because, as you all know, that we are under the economic disruptions during COVID, and various format of health documents verifications are exist, and they are not talking to each other. Yeah, so I think we need to have some platforms, same platforms, so they can communicate with each other. And then this harmonization global health protocols is intended for the G20 countries with possible extension use. I will explain later that we already talked with many G20 countries, selected, not all yet, but to get their support, and we discussed whether this harmonization global health protocols is just the beginning for use for COVID, for vaccine information, and for test information. And later on, we can, there is a possibility that we can use for extensive use for other things, and hopefully there is no other pandemic in the future, but if there is, then we can use these platforms. Okay, so what we, I'm not a technical person, but we have a very strong technical person to back up with this initiative. So we will have a universal verifiers for seamless international travels, and a digital of health documents for travel document standard. So basically it's just like a passport, you know. And we have, I think WHO has ones with a yellow card for the health vaccine at that time. So this is similar to that concepts, but we are using digital. Next slide, please. Next slide. Okay, so little bit background, how COVID disrupt the global supply chains. I'm sure that everybody knows that COVID has led to disruption in the supply chains of some manufacturing and also medical products, as well as the global trade. Yeah, so 90 countries were locked down at that time since March 2020, and then 5% reduction in the global real GDP based on the forecast that we gathered from the OECD, and 15% decline on the world trade and global demand. And I think it was expected that the global trade activities was impacted around $12 trillion, including the medical products. So with this severe impact here on the COVID, so we thought that, next slide please, we thought that we have to build some platforms so we can really, yeah, so we can really increase, yeah, the tourism. And a little bit of background again on the priority issue, that Omicron has expanded to 150 out of total 195 countries in the world, and its impact on many sectors, including trade, tourism, education, and as well as to the economy. So with that background, we thought that we need a recognition for health documents related to COVID. Yeah. So the justification is we know that COVID test and vaccine certificate requires to travel as a travel document across the border. And then from the last G20 meetings in Italy, I think the G20 leaders in 2021 committed to restart international travels in a safe and orderly manner. So with that, we thought that we have to develop something. The innovation is already started last year, but it's not yet materialized. So the third justification is countries have different implementation of WHO digital COVID certificate guidelines. We will explain a bit how takes time, yeah, for WHO to release the certificate guidelines. And then the number 4 is the country have a different verification mechanism for the digital COVID certificate. And then the last one is the digital COVID certificate are not recognized from one country. When travelers across the border, they have to use a different mechanism, as what has been explained by Sekjen, that many countries adopt a different mechanism and they are not talking to each other. Okay, next please. Next please. Ya, no, enggak sebelumnya. Ya, okay. This is just the overview. This is just the overview of vaccine certificate recognition. Why we thought that it's very important to have some harmonization, global health protocol standard. Learning from what we already experienced in the COVID, we all know that the COVID started, I think, the outbreak at the end of 2019, and WHO discussed about the standardization of vaccine. It takes 1.5 years to develop the process. So they are talking about the guidelines development, and finally, on August 2021, I think WHO published a digital documentation of COVID certificate, vaccination status guidelines for the global use. Even it takes 1.5 years, and I think it's still good. We call it the blue books, and many countries refer to this blue books, and within 3 months, 90 countries already adopt. Yeah, available in countries with low connectivity, using an offline and also an online. Implemented to wide range. This guidelines has been implemented to very wide range of systems. So EU DCC, ATAYO, VDC, Smart Health Cards with the US, DFOC, yeah. Many countries has different systems, but at least they use refer to the guidelines. So at the current time, I think WHO is also in the process of releasing, hopefully soon, releasing the test certificates. At the time being, we have vaccine certificates guidelines, but in the coming, there will be a test certificates. In that, we know that WHO is also revising the International Health Regulation, IHR, and we heard that the IHR will be releasing sometimes in April or May. Okay, learning from that, we thought that it will be good to have some platforms. So in this G20, in the Health Working Group 1, we have the goal that we would like to have agreement on the COVID digital certificate recognition. So this is like a recognition, mutual recognition protocol to be implemented in the G20 countries. So hopefully by June 2022, when there is a high health ministerial level meeting, all the health ministry will agree and sign an agreement, that will be support for the digital certificate. And then another goal is uses the certificate recognition intended for the long-term use. So this is a platform that at this time during this pandemic things, we will use it for COVID, and then with the hope, if there is another pandemic, or we can use it for any other wider application. For instance, for vaccine, information for other vaccines. And then the third one, we will also hope that there is a trial in several G20 countries as a pilot. Next, please. Next, yeah. So I think this is our last slide. The priority issues, as what just mentioned by Pak Sekjen, harmonization global health protocols. We have a program that we will harmonize of COVID certificate recognition at the point of entry. When we develop the concept notes, we discussed with selected countries, using a different platforms, and we also discuss with the international organizations like WHO, OECD, and others, to get their support. There is many discussion whether clarification, whether there is a data sharing, a data exchange, what is the data element that is in the QR code. It's a very important issues, and we just mentioned that at the present time, maybe we will select the data element very minimum standard, and we will implement, we will include just information for the vaccine certificate, and maybe there is test certificates, because we know that in some countries they don't apply any more tests for international travelers. So the expected outcome, we will have at the end of this March, we will have a health working group meeting, I think on the end of, on the 28th to 29th of March, and follow up by a side event in TB. And then with that, we still have time to negotiate, to work, and to ensure we complete the concept notes. We already circulate to all the G20 countries with the agenda that we will put on the discussion by the end of March. And then hopefully we will have a productive and enriched discussion during the end of March. And we have something, hopefully, that everybody is already support, Based on our preliminary discussion, basically mostly really support for this initiation. And then we still have time to enrich what should be included in the data element until agreement, which we plan to have the meeting in June, end of June 2022, which is the high ministerial meeting. So the leaders agree, hopefully, on harmonization of the protocol on mutual recognition. And then the second one is the universal verifiers for COVID digital certification. So the agenda of the health working groups is linked to the recovery industry by strengthening the global health security. I think that is our presentation for the health working groups one. Thank you, and give it back to Ibu Santi. Thank you.
Thank you for that, Ibu Belki. Really very comprehensive. We will have a Q&A session towards the end of this event. So please hold your questions if you have any for Ibu Belki towards the end of the event. We now move to our next presenter, Dr. Raymond Chandra Winata. He is the Director of Research and Business Development at Dexa Medica. Dr. Raymond, the time is yours.
Well, thank you very much, Ms. Shanti. Good morning, ladies and gentlemen. Obviously, we are here together in the meeting, very important meeting on the G20 in terms of the future health sector, the healthcare working group dialogue of the T20. So today I'll be representing the industry as well as our scientists working on the green pharmacy, which is I'm looking into the ecological perspective. And hopefully at the end of the presentation, we will have a new refreshed understanding about how green pharmacy can actually increases not only resilience of a country, but also the prosper of the medication of the future. So let me start with the ecology. The ecology, as we know, is actually is interaction and relationship between human and environment. Obviously, we live side to another with animals, plants, and things like that. That will actually allow us to do develop an ecosystem within our Earth. And then if you look into the on the left hand side, you will see that individual over there I put into animal, but actually this also pertains to humans. Individuals that collect together becomes population. A lot of population becomes community, and those community will develop a network of ecosystem in which that ecosystem will actually enrich and part of the biosphere. Now we have to understand that this our interaction with ecosystem, especially with our nature and our environmental, has been going on since the dawn of the century, even the history of humankind. So we should not neglect that we actually are actually dependent upon each other, and we cannot neglect that we have to also to take care of our ecosystem, ecology, and our biosphere. This is why green pharmacy is very important in our life, because as we human being becomes more cultured, we gather a lot of knowledge, we gathered a lot of technology, which allow us to develop a social system based on technology, based on the knowledge, our intelligence, and the whole population. This is what interaction is needed in the ecological system, interaction with the ecosystem, which we know it's actually going to the network within itself, as we have spoken before. So it's very important that we respect our environment. It's very important that we respect our ecology so that we can actually, as a human species, we live long enough in this earth, which is we love, and also that allow us to gather many of the earth product system that can be used into the social system of our living, in the ecosystem of our social life as a human being. Now, one of those beneficial things in which we can gather is plants. As you know, plants are anywhere. Like a country like Indonesia has many different plants, many different medicinal plants that can be gathered into green pharmacy. This is very important because as we plant emerge to be one of our ecosystem, it enhances our life. For example, we can get drugs from the plants. Vincristine, for example, as you can see here. Also, this is a plant material that can be used as an oncology drug, and so many other that we can be used as a supplement in everyday's day-to-day living. So plants is very, very important part of our ecosystem, which allow us to grow and live as human being in a very, very good ways, which is in harmonizing in nature with our ecosystem. So in order to do that, we have to understand that green pharmaceuticals coming from our plants is actually a divine of bioactive ingredients. This green pharmacy consists a lot of substances which will have, which will allow us to have a pharmacodynamic kind of effect on our body. Also, the influence of the gene and protein expression, main secondary constituents. I remember that our Menkes, our Indonesian Menteri Kesehatan, which is the Health Minister of Health, allow us now to think that we can not only think about the therapeutic, but also looking into the genomics of our living being, of our patients. Now, this green pharmacy also has the influence on the gene expression, mainly because of it has a lot of ingredients within the green pharmacy itself. So when we define green pharmacy, it's actually substances can have a lot of effects on our body, and hence it have therapeutics and health effects on our body. And if you go further, actually the green pharmacy is actually can be defined as a compound that will allow us to have even on the effect of the genomic as well as proteomic. This is a method, this is a system that we can not only in the therapeutic area of the biological as well as the molecules. Now we go into not only physiology, but we go further into the molecular of diseases and patients. So the green pharmacy allow us to do that because it has effect on the DNA, RNA, protein, and also metabolism of the human body. For example, if you have a pathophysiology condition, you can reverse that using the green pharmacy into the different transcription of the gene and so on to become well. Now, we are very in the midst of the prevention medicine. We are in the midst of the correct conversion of the conventional to functional medicine. What is a functional medicine? Functional medicine has to be one that's health-oriented, patient-centered, holistic. Obviously, we have to see a patient as a whole point of view, not only one area reductionism in which we only see the liver, we see the heart, we see the lungs and so on, but we have to see the human body is holistic. And then we want to show the preventative approach. So in this functional medicine, we go into prevention instead of only curing of certain diseases. And with the green pharmacy and natural medicine, it is possible to do this. It's very easy because green pharmacy, we can target certain gene and protein, and obviously the approach would be very individualized. So if you look into the precision medicine now that's being developed into the biological product, now green pharmacy can also fit into that category. And obviously, there's publications, a lot of publications of green pharmacy now available on the internet, in the libraries, as well as journal being published every day. This will enhance our understanding on the green pharmacy, and obviously the effect, and we can learn some more of the effects of the green pharmacy, which we actually tend to neglect because it's coming natural, so it's not making a good effect. It does not have a good therapeutic effect, so not that way, because all these publications can suggest that green pharmacy is not inferior to the typical pharmaceutical. And many of those green pharmacy actually can be used. Many parts of the typical plant, for example, from the root, from the bark, from fruit, but many of these green pharmacies actually coming from the leaf as well as the root. And this publication shows that we have a lot of these leaf and roots even in the developing countries such as Indonesia or other surrounding countries that we can develop potentially further be used in the healthcare sector as a green pharmacy. Now, obviously, in order to be modern, a green pharmacy has to go through a modern discovery process. You cannot go to a plant, typical plant, and traditionally use a certain indication. We cannot assume that. We have to use some molecular biology technique. We have to use some drug discovery technique to make sure that the green pharmacy will allow us to develop medication of the future. even though it's coming from plant, coming from the nature, but yet we have to develop a certain ways that make sure us that the green pharmacy can be accepted as a modern therapy, modern therapeutic value, modern therapeutic drugs. In such a way, not only we're doing from the beginning, which is first in the beginning, right from the beginning, but also we have to gather the data in terms of the clinical trial. The randomized clinical trial, which is control versus active product or versus placebo, has to be done to make sure that the green pharmacy will conform to the international category of drugs. In the future, the green pharmacy should make up majority of drugs that has in a formularium, national formulary of a country. This is our dream, but also it can be done if the government and the private sector and then the academia sector work hand in hand to make this possible. Because the green pharmacy is a very good proposal for many countries. Now we know that conventional medicine has been very, very useful in terms of therapeutics of human beings, in terms of therapeutics of patients. As you can see here, it's a recent data suggesting that yes, many of those burden of diseases can be broken down or even lowered down. Burden of the disease can be remedied by conventional medicine. As you can see here, this if you look into the defined daily dose versus the disability adjusted life year, you can see many of this metabolic disease or even progressive disease and like cardiovascular, oncology, mental disorder, diabetes, and things like that can be remedied by conventional medicine. But as such, conventional medicine is now the mainstream medicine being used in the healthcare sector. But yet we tend to forget that this conventional medicines, majority coming from the small molecule, also have risk on the ecology. Because why? Because the nature of the conventional medicine, which can go, from the R&D manufacturing to distribution, consumption, to the waste management, will have possible releases on also human impact on the environment. Now, to dwell further on this, we know that the human exposure routes to the medicinal product has been documented many ways. I will show you what's happening in India, for example, in Hyderabad, also in the backyard of Jakarta. Essentially, the human pharmacy, which is taken by people, by the patients, this is pharmaceutical from the small molecules, also can contaminate drinking water. Also, drinking water can go to the sewer, to the wastewater, and then we know that there are so many pharmaceuticals also accumulated in the wastewater or even in the sea, in the surrounding an island surrounding area of a typical urban area. Now, this is the more technical way. It can go the medicinal product, the conventional medicine from human use or even animal use can go to the surface, even surface water, groundwater, and it can contaminate drinking water. Yeah. Now, this is happening. For example, the case study as I've alluded earlier. This is happening in Hyderabad. Hyderabad is actually 50% of India's export drugs coming from. Approximately 170 companies operating the area. They all produce generic drugs or even API, active pharmaceutical ingredient. So it's been studied in the area that the areas can be contaminated. The environment of the area of Hyderabad can be contaminated by the bulk of drug manufacturing facility and also nearby areas, nearby villages, which people live. For example, this Patancheru Bolaram zone, contaminated by antimicrobial. In this case, for example, they use a lot of antimicrobial like for example, azithromycin, could be amoxicillin, could be any of the antibiotics. So essentially, and then also they found 95% of contained waterly high levels of bacteria and fungal resistant to antibiotic drugs. Now, this is in India. It is very, very important that we have to make sure that the environment in which we are producing the conventional medicine, it has to be protected so that it doesn't contaminate the people. So ecology will not be disaster if that is what's happening. And as in the case of Hyderabad in India, we need to make sure that countries in which they will produce the API will have to have containment of this particular problem for conventional medicine. Now, this is not only happening in India, but also in our backyard, the backyard of the Teluk Jakarta. Also recently we found the concentration of paracetamol in the Jakarta Bay, for example. And next study, people also find out that it's not only paracetamol contaminating Indonesian soil, but oxatetracycline, sulfametaxol, trimetrophin, and also detected in the aquaculture sites in Java, Indonesia. Ladies and gentlemen, this is coming more and more that we have seen the pharmaceutical landfill, pharmaceutical and the water sewage, which we have not studied in this country, in Indonesia. But I think if we have studied, we will see there are more and more of this happening in our backyard in Indonesia and maybe surrounding countries in Indonesia. So that's why if you look into the earlier speakers alluded that the also antimicrobial resistance is also important, because if the conventional medicine goes into sewer, obviously all the bacteria will be resistant, and some of the resistant bacteria will get into the patients, it will get into our body. That will increase the mortality rate. As suggested by the recent studies, by 2020, 10 million people of antimicrobial death due to antimicrobial resistance. And this is actually similar to the death rate of cancer, similar to even higher than diabetes, diarrheal disease, or even road traffic accidents. Very menacingly, very important that we need to put attention into the antimicrobial resistance, not because people taking a lot of antibiotics only, but also the antibiotics will taken by people will be excreted and contaminate the whole system, the ecosystem of the ecology of a whole particular country. And this is where green pharmacy can play a role. Green pharmacy is not only commercially and environmentally friendly, but also the green pharmacy actually can absorb more greenhouse. It can get rid of the carbon. Why? Because we plant more plants, and plants actually take off the carbon dioxide. So not only that, when we into the, this is not only synthetic from nature, absorb the greenhouses, and also green pharmacy consists only on say carbonic material, carbon, nitrogen, oxygen, phosphate, and things like that. So essentially also the waste product, the green pharmacy, after we do the production, can be mixed with the farmyard manure, becomes the EFF, which is environmentally friendly fertilizers. Let's not forget that this actually the waste product of the green pharmacy, after they being produced in a typical factory, we can recycle them into the soil, into our ecosystem, into the environmentally friendly fertilizers, and hence allowing the growth of many other plants, many other trees, which will bring the richness of the ecosystem of certain area. And hence the environmentally friendly fertilizers do not increase the NO emissions. It might increase the organic matter. It will adjust the soil pH so that beneficial bacteria only will grow within that particular soil. And also, obviously, it will improve the water retention, water holding capacity, and the whole thing making our living being, our ecosystem much more healthy. This is what we need to understand. We need to create the green pharmacy, because it will actually impact the human being very well. Versus conventional pharmacy, in which you saw earlier the impact, the environmental impact to the conventional pharmacy. If we plant more plants, medicinal, it will create a betterment of the human species, of human race. Now, our previous speaker also alluded that we are in the living in the midst of COVID-19. Obviously, the supply chains will be broken somehow because of the COVID-19, and in some countries also not able to export some of the raw materials which we use. But also recently, the invasion of the Ukraine by Russia also chaos for the global supply chain. If the green pharmacy is being protected, if the green pharmacy is being making it into a priority within one country, we don't think that the supply crisis, because the availability of raw materials in the country, we do not have to export. We don't have to import of those raw materials. In fact, we have supply, and every time and anytime, if we could put an economic chain value in which green pharmacy can add to the country, we actually are helping the growers. We are helping the sustainability of the growing system of the farmers of a country. They can provide a good supply chain of raw materials into the green pharmaceutical supply chain system within one country. So with the green pharmacy, we can potentially avoid many of these issues in terms of the global supply chains. And at the end, ladies and gentlemen, I would like to conclude my talk that green pharmacy is an agenda that we need to think about. The green pharmacy actually can protect a country from a supply issue, from the environmental issue, from the problem of the healthcare. The green pharmacy actually is there on only when we realize and we put a lot of agenda, we put a lot of action into it, then the country can become independent, having a good environment system, ecological system based on its production system. Also, it will increases the betterment of the life of our growers and farmers, so that we will be independent in terms of the API, active materials coming from our green pharmacy of a country. And that actually benefits not only the provider, but also the patients, especially when it's put into national formulary. Because if you put into national formulary, the whole citizen will be able to get the benefits of the green pharmacy, which will be put by the, for example, by the Ministry of Health. And then the patients will get green pharmacy, which is grown in that particular country. For example, in Indonesia, the patient will be getting beneficial a green pharmacy product from Indonesia, which will be not only beneficial for the healthcare, but also for the environment. And we all grow happy together as human beings, as patients here in Indonesia. Thank you very much for your attention for today's meeting. Thank you.
Thank you for that, Dr. Raymond. I think that is very insightful and a totally different outlook on ensuring sustainable healthcare in Indonesia. We now move to our last speaker, Professor Hasbullah Tabrani. He is the chair of T20 of Global Health Security and COVID-19 for G20. Professor Hasbullah, time is yours.
Thank you, Ibu Shanti. Good morning, good evening, good afternoon, wherever you are, the participant, expert, government official, and whoever you are who are interested in the reforming the world in the health sectors. So I'm going to a little bit address some issues that we have heard from the Minister of Indonesia about the global new architecture that the Indonesian government, the working group, would like to propose to G20. However, we should not focus on the Indonesia, since G20 represents about 60% of the world population, and thinking for the G20 only will benefit a lot of people. And in addition to that, we can also contribute to the world development. So the T20 is looking for innovative ideas, innovation from hold on a minute, from all of you who are willing to contribute to see the world changes. We are looking for the response to the ministry's ideas. This is not for Indonesia. This is for the global, and for the detail where and how we should go about it and to achieve a new global equitable of health system in the world. Let me start next slide to show you that COVID-19 has give us warning, a very, very strong warning that economic activity, not yet, economic activities contracted in about 90% of the countries. This is the largest economic impact after the World War II, even larger than the impact of World War II. And certainly this COVID-19 awakened us that healthcare, health system, pandemic can ruin economics. In 2020, the global economy shrank up approximately about 3% of the world economy. 3% of GDP of the world is it's about $3 trillion US. It is a huge money. That's over the world. And we know that the data also showing that more than 100 million people went to poverty due to the COVID. So we can see during this COVID pandemic, that the impact of healthcare to economics is very, very strong. On the other way around, if the economic development can also improve the healthcare. So how do we proceed with that? Thinking new architect, new financing, new scheme. Next slide. So these three initiatives that the Ministry of Health of Indonesia is looking for to contribute to the global new healthcare architecture or environment, whatever that means. This already discussed and described clearly by our previous speakers. And also Raymond already discussed one of the solutions that remember last year after the G20, our president went to a climate change meeting. That's very coincident that pandemic and climate will be a big impact, will have a big impact to the healthcare and the economy. Next slide. I just want to pursue more about the first initiative, just as an illustration that we are working more on this. Other than that one, T20 already identified 10 policy areas that we are working on it, but financing is an important element. Just to give you a brief situation where we are, here is the health financing as the proportion of the GDP. This is total health expenditure of the proportion of GDP in G20 countries. Yeah, you can see in the left side, mostly the developed countries, which we can see the United States absorb the highest proportion of GDP for healthcare, a total health expenditure reaching about 17%. Why? Is the Americans are sicker, or the systems might not be good enough to ensure that the healthcare system is efficient. If we look at the outcome for, in many ways of the measure, many research found that the outcomes not as good as it expected, or the outcome is about the same with the other developed countries, meaning that something that in the health system might not be efficient there. But if we're looking at the developing country or emerging countries, starting with South Africa to Indonesia on the right, we can see most of developing countries spend much lower in terms of percent of GDP. The spending on the GDP is a measure of how the countries prioritize healthcare, how the countries look at the healthcare as part of the long-term investment. You can see this change for almost 2 decades from 2000 to 2018. Most of the developed countries increased their spending, but in the developing countries, even in Turkey and India, a little bit decreased as percent of GDP. So this challenge for us, but percent of GDP is still just a relative measure of the financing. Next slide. The trend, the increase is important. So we can see here, although in developing countries, spending for healthcare as percent of GDP relatively low, but in the last 2 decades, most developing countries are catching up with the increasing spending as proportion of GDP. So we can see here South Korea has aggressively increased almost double of the GDP in the last 2 decades. Indonesia also followed quite good, Saudi Arabia, but Turkey and India is a bit down. So this is important to observe how we can improve people health, since most of the healthcare infrastructures heavily rely on the financing. If we have adequate financing, right amount of financing, it's not too much because that's not efficient, but not too low. So we provide balance of this financing to ensure that efficient healthcare and people benefit the most. Maybe the green pharmacy is one way to do it. Next slide. So if we look at the spending per capita, because if we look at only the GDP side, maybe it's not good measure to see how much countries spend. Then we can look at the per capita expenditure in international dollars. So this is comparable spending. We can see also the blue line, the percent change in developing countries, emerging countries have a much higher change, while in developed countries, relatively, the changes over time is relatively stable. So we can see that maybe soon the average spending per capita in international will be more equal across the countries. But this is our challenge. How do we go to that from the spending very low in international dollar? The US spend more than $10,000 per capita per year, while Indonesia spend only about $120 per capita. But with international dollar, it can go to $300, $400. So very large differences, while other developed countries roughly spend around 4,000 to 5,000 international dollar per capita per year. How developing countries should capture more money, should mobilize more money, or how developed countries could assist developing countries how to mobilize more money to ensure that 10 years from now, in the 2030, the SDG goal can be achieved of universal health coverage without mobilizing aggressively on the financing, identifying what source of financing. It will be very difficult. Lesson from other countries can be useful to share during this G20. Next slide. See, again, this is the important element. If we talking about equitable healthcare, only public financing, which is the government spending, or quasi-government such as Indonesia, we have the BPJSK, which is also public funding, is the only financing scheme that rely and contribute significantly to the equitable financing. The COVID-19 certainly show us that private financing is inadequate. It's just complementary. The public financing is the backbone for that. But if we look at the G20 countries, Indonesia and India remain the lowest spending of the public money in terms of the percent of GDP across all these G20. This is a big challenge. Since next year, India will be the next presidency. I think the move to follow up of this new global architecture in terms of the financing will be a very important component. Next slide. We see the similar trend, which is in the beginning, the Secretary General also mentioning, we want to track down, want to identify what is the trend, what is the situation, what are the landscape of health financing and health landscape of global health architecture. So we can see Indonesia is quite good in terms of moving the public spending that increase in 2 decades about 60% in terms of percent of GDP. Its movement. China even more aggressive with increasing almost 70% compared to 20 years ago in terms of the spending of GDP. This public expenditure is a measure of the government commitment to ensure adequate financing and to ensure that equitable healthcare will be provided. Next slide. See, the world affected with this disease situation. Here, the World Bank report just issued last month or in January, showing how the economy of the world shrank because of the COVID, and then starting last year, it's already recovering slowly with different stages across different world. But beyond that, it is also important to notice that the climate change, the weather change, the climate disaster will be a big or maybe bigger threat for us. So this is the bank reported the potential loss, the economic loss reaching almost $2 trillion US dollar also. A total of the advanced economy and the emerging economy, or IMDEs. Yeah. Then how can we do it? If we look at this situation in the lesson from COVID, the financing and the economy clearly affect the access and the provision, the supply chains of the supplies of medicine or vaccine. We observed that in the vaccination, more than 70% of the people in advanced economics already received COVID vaccine. In the emerging market, it is 55%. If we look at the report of the World Bank, only 8% of the population in low-income countries receiving vaccination. So this is look like their problem of low-income countries. But if we look at the high travel across continents, across countries, this low vaccination might be threat to a new spread of disease if we cannot help those developing countries or low-income countries to cover vaccination. And therefore, it cannot be just their responsibility. And therefore, there are a lot of discussion about the global public goods of this vaccine should be established. Yeah. Because it will protect also us in emerging market and also in developed countries. Next slide. So the bank groups remind us that we have to help all of the countries to recover from this, and just showing here the example that the World Bank in 2021 starting from previously in the toppling pandemic, already deploy about 157 billion US dollar for COVID-19. Is it enough or not enough? And is it adequate just to provide the fund, or we need other work together, how to mobilize, how to establish good resources, not only money, but also human resources, technology, digital information, to ensure that those underserved countries can also recover from this pandemic. And in the end, all over the world, developed and emerging market will also receiving benefit for this. Next slide. Yeah, so that's yeah, I think this is the same combine how the green this is a coincidence actually. I like the presentation from Dr. Raymond. The thinkings at the green pharmacy, which is developing new medicine from plants that probably will help to reduce climate change, will improve green's world, And if we look at the situation currently, this year, the presidency in Indonesia, which also have a lot of phytopharmaca, basically, and source of the phytopharmaca in these tropical countries, and India next year also having a lot of experience using herbal medicine, whatever Ayurveda medicines, and the following year it will be Brazil, also a rich country on the tropical forest there, that we can find a new medicine that probably will benefit the people around the world with greener situation in the world. Next slide. So in the conclusion that we know that the disaster will be coming, both natural or human created disasters, but we never know when they are coming and how big they are coming. Hopefully not as big as this pandemic. In the past, we have MERS, we have SARS, we have also other disease, bird flu. It's coming. Yeah, we have to secure that we prepare for that. All of the developing countries should improve health financing system to have resilient health system and quickly respond to any new disasters coming in. In that situation, we cannot just work alone. I expect that we can invite innovation from all of you, how to coordinate in the global work together through this G20. So we are expecting some of you who have great ideas, please send us your abstract, your ideas, then we will discuss. We still have several, about 9 more workshop or roundtable discussion like this until we find a good concept note that we will be offering to the G20 in this 2022 in Bali. Thank you. Back to you, the moderator.
Thank you for that, Prof. Hasbullah. Really very insightful. We are actually close to 11 o'clock, but we have quite a lot of questions and very enthusiastic participants here. I'll straight get away into the questions so that our speakers can attend to them. One of the questions we have here is for Ibu Becky. The question is, do you have real data of international tourism arrival impact using current year 2022 instead of using 2019 data? So I repeat the question, do you have real data of international tourism using 2022 data instead of 2019 data?
Bu Santi, thank you for the question. Yeah, I think since we collaborate with many with other ministerial level, so I think we can gather the data based on the 2022. But 2022 travelers from up to February, I think we already have it. Because all the arrivals, and result of tests, we really monitor day by day on the result of PCR tests at the point of entry. Since 2022 is still on March, so I think we will get it, the data, and I think we already collaborate with the other minister for that. So basically on 2021, on the data from the 2021, we already have gathered the we can have the arrival with using which airline and from port of departure and arrival. I think in 2021, the point of entry with guideline is still ready. So I'm sure that we will get that information. Thank you for the question.
Thank you for that, Ibu Becky. Next question I have here is I think this is for Dr. Raymond. Dr. Raymond, looking at the current condition of healthcare industry, both from supply chain and value chain, what should Indonesia do to increase readiness in the development of utilization of phytopharmaceuticals?
Well, thank you, Ibu Santi. This is very important questions. And I think as Prof. Hasbullah alluded earlier, this could be one agenda in the G20 in preparation of the G20. Because in this particular case, for example, here in Indonesia, obviously we have used a lot of green pharmacy in the public sector, but yet we have not used it in the governmental sector. This could be enhanced. For example, we use the available green pharmacy available already for the health of our patients, and we can also need to increase the therapeutic areas covered by the green pharmacy. And hence, there are a lot of opportunities in which in this G20 that we can offer that, for example, we can help a consortium of the government and then the private industry and the academia to make more of this green pharmacy in the future. But let's not forget that we already have a lot of green pharmacy available at this moment without waiting for more and more green pharmacy to come. I think the government should put attention to this green pharmacy, the potentiality, not only therapeutic value of Indonesia, because of the events like previous speaker already taught, Ibu Prastuti, that the supply chain in the world is also menacingly threatening Indonesia for the supply of the active pharmaceutical ingredient, while the green pharmacy is so abundant in our islands in all area Indonesia. So I think the commitment, focus in execution, and also the understanding the green pharmacy actually increases the leverage for Indonesia as a whole in the healthcare sector, as Professor Hasbullah alluded. I think we need to do a lot of make this an important agenda for this upcoming G20 meeting.
Thank you for that, Dr. Raymond. One more question which relates to phytopharmaca is, what kind of policy directions and potential collaborations are needed to encourage the independence and resilience of Indonesia health services through the development of phytopharmaceuticals? I think this also relates to Pak Menteri's, the minister's speech earlier in terms of resilience of healthcare in Indonesia, which is becoming a very important aspect, especially after the COVID-19 incident. Please, Dr. Raymond.
Yeah, absolutely, Bushanti. As we go through in this day of age of the precision medicine, everybody is talking about genomics, proteomics, and things like that. Green pharmacy, even though it's based in the herbal natural system, doesn't mean it's traditional. The green pharmacy, as we know about now, is actually as modern and as high-tech, using high technology as the previous conventional drugs do. Why? We have to develop in such a way, because otherwise it will not be acceptable internationally as therapeutic exchange, a therapeutic alternative to the conventional medicine. So in that way, the policy has to be put in such a way that the development of the green pharmacy can enhance the whole economic system of this country. Not only that, the scientists have to work and think in the modern way. And in addition, the government has to be put the green pharmacy in use in their facility. So we're not talking about the healthcare providers, which is given by the private sector, but also on the government sector. For example, the general hospital and things like that. So if we do that, I think the green pharmacy will flourish even more in our country, not only based on the traditional sense, but also in the healthcare sector, in the ideas of precision medicine in which green pharmacy can be developed upon.
I think this is like the TCM in China and the one in India and also in Germany. I think moving towards that directions, right, Doctor? Yes,
that will be very reasonable to do in Indonesia, in any other parts of the country, and also other countries. That the India has Ayurveda, China has TCM. Yeah, Indonesia has jamu. We also have Phytopharmaca, which is ready to be used by the government in the healthcare sector.
But I have comment, Busante, on this. Yeah.
Sure, Prof.
I remember. I think it's about 25 years ago. I was in the planes from Mexico City back to San Francisco. On the way, I met a guys. I don't remember her name next to me. Just telling, knowing that I am from Indonesia. She said, "Well, I just went to Kalimantan 3 months ago to Dayak tribe. Why did you go there? What for?" "Well, I'm trying to find maybe traditional medicine that probably will be very good for the future." So I think be careful. Somebody's from other countries can benefit more. Maybe now she or he or her company already developed a new purified plants for maybe certain cancer or whatever. I don't know. No, well, certainly we know the Pasak Bumi is very popular there. Yeah, that's from plants, and then how we purify it. I think this can be a great opportunity for developing countries, which provide a lot of plantation for this or herbal medicine at this time, but need more technology. And I think the government should invest on this to provide incentive on purification or studies, longitudinal study to see the effect of this, because without evidence, then it will be difficult to sell to the world. Thank you.
Yeah, I think that's very good. There's a comment here from, okay, Ibu Becky, please. You may unmute yourself, Bu. I think you can unmute yourself. Rhea, can you help?
Yes, thank you.
Okay.
Thank you. Just to echo what Raymond just mentioned, yeah, that it's true that the minister is very seriously pay attention to support the traditional medicine, especially to support the research and development. And I think just a week ago, yeah, he invited all the university-based and also any potential of using the traditional, the development of the traditional medicine to do more research. And then I think he also suggests to incorporate all the findings, I mean the result, of course, with the agreement, the licenses from the Badan POM should be incorporated with the hospital. So at least the development will be much faster, as what China also did some efforts. Okay, thank you, Bu Santi.
Thank you, Bu Becky. I think very good input there. You have a big work, I think, with regards to phytopharmaca. I hope G20 this year in Indonesia can open up a door, for this country to be more sustainable in healthcare. I think that is a very good new opportunity that we see here. There's a comment here from Dr. Anwar Santoso. Yeah, and he said there's actually a committee of herbal medicine on phytopharmaca at MOH. I think it should be a good cooperation. There you go, Dr. Raymond. You have a clue here. And thank you for Dr. Anwar to highlight this. So I think Ministry of Health already have this division on phytopharmaca, which is a good aspect for us to explore further. Good. So yeah. So we want to proceed further. There's a question here for Prof. Hasbullah from CHISD. And the question is, what does the new financial mechanism that Indonesia has in mind look like? What is the role of private sector, financial institutions, and CSOs in this mechanism? how will this mechanism work with existing mechanism? I'll repeat that in a bit slower tone, Prof. Hasbullah. What does the new financial mechanism that Indonesia has in mind look like, and the role to private sector financial institutions, CSOs?
Okay, well, we are lucky in developing countries that we have learned from experience from the US, experience from UK, from other European countries, Japan, Korea, that's already ahead of us in terms of financing and scheme. We know that, as I mentioned before, public funding is the basic for everything that ensure adequacy, ensure equity. There is no other way to do it. But the public fundings only cover the basic healthcare need, meaning that the needs of the healthcare that's covered by this public financing. While in the demand for healthcare, in addition to the need, there are also several prevalence, privilege that people want to have a better care, want to have more choice and so on. That can be accommodated by complement or supplement private funding. So this blended public-private financing should be harmonized in such a way not to degrade the public funding, but rather strengthening each other's. The private sector, certainly with GSO or the private health insurance company or corporation, can complement that. This is the fact that the world doing that way. So we can find a new solution, but I'm sure not much different from that. What we need for Indonesia, it is for Indonesia, is, as I saw the data, is just to make sure the principle of adequacy, adequate financing. If we finance very low, similar like Pak Raymond in the medicine, providing drugs, for example, we use paracetamol to cure or to reduce pain, we use only 100 milligrams, it will not be effective. We need a minimum 500 milligrams to have an effect. If we just provide 100 milligrams, we just spending money to buy that medicine without any effect. Similarly, in health financing, if we finance very low, below the adequacy level, then the impact will be very small. If we provide adequate financing level, when we have to choose for the public, for example, because the public money always limited, we have to choose the most cost effective. Maybe the green pharmacy, the Phytopharmaceuticals that developed from local will be cheaper. Then it should be included in the formularium or the coverage on this one. I think in China, they already covered that, yeah. Indonesia, probably we have to learn more and assess more. Certainly, GSO, private insurance can complement. The good news is that in January this year, our president already issued an order in Press 1 2022 that also instruct Ministry of Health to accommodate how the public funding, the JKN for the healthcare, should be complemented with private funding, both from private health insurance or public corporation companies can top up, but no other way. No, meaning that we don't go like to go to the US where the people in the employment sector, active employees can choose opt out buying private insurance and not joining the public one. We had a big mistake in the past when we introduced JP Kajang Sostek. We allow opt out, those who can cover in theory better benefit could opt out from the public system. In the end, after 20 years of implementation, only 5% of the employees and the family were covered. So it is a lesson that we can learn to improve our system. Basically, we will strengthen the public financing system. There are still it's about 30% out of pocket that we could mobilize to be instead of paying out of pocket at the provider at the time they need a service, they have to be switched to mobilize to pay in advance as contribution or health insurance premium in the private health sector. That will be much more efficient. Thank you.
Ibu Becky, you raised your hand earlier. Do you have anything to add?
Ya, ya ini Prof. Hasbullah is my guru ya. So I'm just adding. I cannot add. I cannot say more, but I'm just emphasize what he just mentioned. That in his presentation, the public financing is getting better. So that's one side, one good side. Even like he mentioned that the proportion to the GDP are still need to be improved, yeah, because we are very stable and at 3.1, 3.2% of the GDP, but the government commitment is getting much better. With the COVID, I think we have to also acknowledge that the government realized that investing in health is very, very important. So that is, I think, a very clear message. And I think with the interest that Perpres ya Pak ya? Perpres sama Impres ya?
Impres.
With the interest, I think there is an instruction that we need to do some alignment, not reforms, but alignment that with more participating on the private and even public financing is getting better, but involving on the role of private because of the government resources is limited. I think the role of private should be open to this. One of them is you know that we are in the process in the government, in the Ministry of Health is in the process of defining the basic essential health services. Yeah? Basic health services, meaning that we will not reduce the benefit package of the JKM, but we will only limit to the very essential one. If the other, if the patient wants to more advanced, using more advanced drug, advanced technology and others, yeah, we will coordinate, open collaboration with the private health insurance. So there is a new business also with the private insurance to jump in. We know that when we realize that the growth of the private health insurance, the growth is quite significant, even is still have a small market. Yeah. But I think with all the regulation and let the private insurance as well as the private providers also have agile flexibilities in doing the business, collaborate with the BPJS. I think that's a good opportunity for them to catch up the market. Thank you.
Thank you for that, Becky. I think really excellent discussion we have here. We are over 11 o'clock, but we still have questions and we still have 300 participants in this room. So I think we will just continue for another 10-15 minutes and see where it goes. But we have one question here. It's from Ayunda. How to boost people's positive health behavior in this condition of pandemic? Policy about tackling COVID pandemic, mentioned to dynamic policy on testing, tracing. I think this is anyone can answer this this question. It's more about the testing and the tracing part. Do you want to take it, Prof?
Yeah, if no one take it, I think I saw also a question. I forgot. I just keep scrolling some question and then I forgot which one. Yeah, there is also a question from that I would like to answer, maybe from Elena, about the vaccine. Yeah, effectiveness. Yeah, well, that's part of the behavior.
Yeah.
Yeah, in my view, maybe more than 90% of disease actually related to behavior. Unfortunately, we are paying very little attention on the behavioral change. Yeah, even COVID, for the communicable disease, behavior of people who are not receiving vaccine, rejecting vaccine, or not having a good health protocol, put himself or herself and the people around her or him in dangers. Yeah, so that's behavior. Yeah. Similarly, for NCD, which is now comprised of about 70% of the healthcare costs, consume healthcare costs, and more than 70% of that related to behavior. Indonesia, for example, smoking, 67% of adult males smoking regularly, and yet this is important. Maybe Bu Becky, please convey to government. Yet there is very little message or campaign by the government how to live healthily, aside from the COVID. Yeah, COVID, yes, because it's very close relationship. But for other behavior, we do have GERMAS conceptualized in previous ministries, but implementation or big campaign on this, it's very little. Research, longitudinal research, also very little on this. Hopefully somebody from brain can address this. Cardiovascular disease certainly related to a lot of behavior. How we identify which risk behavior and how to change the behavior requires longitudinal studies. Unfortunately, for countries like Indonesia and many also emerging developing countries, grant for longitudinal research relatively unavailable. I remember in the US, I engaged in longitudinal studies, more than 20 years continuing monitoring certain behavior of children and parents. Yeah. And then we can identify it's 2,000 families were followed for 20 years. Yeah, I was engaged in that in the 12 years. So that kind of studies need to be conducted to be available in Indonesia, and therefore we can then identify clearly what kind of models to change behavior. Certainly, enforcing some regulation is necessary. Without enforcement, people are having short-sighted. They don't see the risk for the long-term risk. So we have to be very strong discipline and give, beside incentive, also disincentive or enforcement for that. Yeah. Unfortunately, looking for example, in the smoking arena, for example, we do have a lot of sign, no smoking, no smoking, but you can see people are smoking down there under the sign. There is no one remind this. So it is a very important element. Thank you for this question. I think we have to put in a very high agenda on this. Thank you.
Thank you. Thank you for that, Prof. Ibu Becky, you raised your hand earlier. Anything to add, Ibu?
Yes, I think this is our homework there from the Faculty of Public Health, and I think this is also responsible of Prof. Hasbullah, changing people. I think from public health, one of the department is behavior. So they have to really change the behavior. That is a big challenge for us, how to make people change their behavior, change and become a discipline. But I think with the COVID, I think we amazingly, we have to also appreciate that they comply with wearing masks. At least we don't know about the wash their hands and keep a distance, but I think many public facilities now provided clean water to get access. That is, I think, the positive things that give us a positive sign that something can be changed. One of the thing that we think why people at the grassroots cannot be changed, I think because of the health education, also the intense health education, how to really tackle, you know, the important issues to based on segment AIDS. And then I think in the future, what we need to try to do is we, for the health education, we will try other things, you know, using digital information, using TikTok or podcast or you know, with the application. And the minister is very into the technology. So I think the way health education using, you know, conventional, we will change that hopefully. And then another thing that we also want is we will monitor the data. So intense monitoring and evaluation, for instance, like with starting with a very priority, for instance, like the pregnant women, because we want to prevent from stunting, you know, from the low birth weight, and then for the immunization, and then for the discipline to bring the babies into the posyandu. This we already develop in the Ministry of Health. We have like a digital transformation, a digital technology office, and the digital transformation built a system mechanism that we will have a real data from the posyandu to the can be accessed at the different levels. So Puskesmas can access, and then district health office can access in the real time, and Puskes province, and also as well as in the central. So there is no data entry, again, no summarize. So it's everything is already digital from the grassroots. We start from a very limited program, and hopefully with the limited, once it will be, it's already running, then we will expand to other programs. I think that's the thing that we want to add. With a positive mind, hopefully, hopefully everything can be changed. Yeah, thank you.
One more, Basanti. I would like to answer this question of Rita. It's about the vaccine centers for Indonesia. I think it's not only for Indonesia. I think the Secretary General was right, the Minister of Health was right, that we need to have additional hubs in the Southern Hemisphere on the vaccine development, on the production of drugs, medicine, even the supply, other supplies, that if something happening in the Northern Hemisphere, we can supply the world or complement the world with the Southern one, because the situation might be changes. Yeah. But I would like to have a good lesson from this Peduli Lindungi Indonesia, and Pak Zekian also mentioning that QR code, that uniform QR code. That for the COVID vaccine, I think it will be good. It is not expensive, in my opinion, to have the similar Peduli Lindungi or the vaccine data that we can see from the application. Not only for the COVID, also for the others disease, tuberculosis, BCG, for example, that we can check people how many vaccine they are taking, what kind of different vaccine. At this time, it's not yet, because there are still disease that probably in the future will have a vaccine. The industry are working on it. Maybe there is traditional medicine can or herbal medicine can develop that. For example, people are talking the malaria vaccine, dengue vaccine that's not widely available. If we can do it, and we can check people who have that vaccine, and then the world will become much better for us, for all of us. Yeah, we can travel all over the world without any concern of getting some disease. Yeah, thank you.
Exactly. Thank you for that, Prof. I think we have overshot half an hour, a bit more, bit less than half an hour. But I think I would like to thank all our speakers today, this morning. It's really a great discussion. We have a very good turn-up, except for the brief moments where our time was hacked. We need to look into that. I think this is a trend now, almost in all meetings where people come and hack. And I'm actually looking forward for an offline meeting, which is going to be, now the PCR is not required. We heard that you are not required to do PCR anymore. I think things are opening up. We hope things goes back to normal. And but then one thing we need to be sure that we need to use the G20 momentum to make sure that we invest in everything that will keep our healthcare system resilient and sustainable. I think we should not just relax just because COVID is going away and surpassing. We need to be always on the lookout. We need to always have an innovation, whether it is using Phytopharmaceuticals or any other innovations in R&D. And I think the Ministry of Health need to kind of like put their foot down now to support this, because we never know in future what type of virus or what type of outbreak or pandemic we will be facing. And I think the G20 momentum is a great momentum for Indonesia to step up, especially the Ministry of Health, and chaired by Prof. Hasbullah here, and Ibu Becky, you are chairing the Healthcare Working Group too as well. So I think to really step up and work with the private sectors as well to make sure that if there is a future breakout, if there is a future pandemic, we are more ready, we are more resilient, and our healthcare system is sustained. I think I would like to thank you again to all our speakers this morning. Thank you for your time. If you have filled the form, we will be distributing the presentation today to all those who have filled the form. We will be conducting Healthcare Working Group 3 sometimes next month. We may choose a different format, maybe not the Zoom format because it is easily hacked. This is not new where you see a Zoom meeting is hacked. So we'll choose a more safer format next time. Thank you again to all our participants. Have a good rest of the day, and we'll be in touch. Thank you.
Thank you.
Bye-bye.
Thank you. Thank you, Pak Raymond. Thank you, Bu Becky.
Thank you,
Bu Santi.
Prof. Hasbullah.
Thank you all.
Becky,
Thank
Thank
you.
you.
Thank you, Bu Santi, Pak
Thank
Raymond.
you, Bu Becky. Thank you.
Thank you.
Izin live.